This time I'll call the January 10, 2022 Randolph County Board of Health meeting to order. Welcome and thank you, board members, for being here via Zoom, and we appreciate your time tonight. And I know that we've got a couple that may be joining us just a few minutes late. Before we get started with any of our business, I would like to do the attendance roll call. And for John, our new board member, welcome. What I'll do is call out each person's first name. If you'll state your first and last name and then state present, we'll do that for the roll call, and we'll also do that for each of the action items that are on our agenda. So I'll start with Courtney.
Courtney Austin Wilson, present.
Robert.
Robert Brown, present.
Mary Ann.
Mary Ann Evans, present.
Alan.
Alan Ferguson, present.
John.
Gray, present.
Carrie. Don't see Carrie. Hope is on her way over from another meeting. Julie.
Julie May, present.
Ryan.
Ryan Snipes, present.
And I'm Marty Trotter, present. Thank you. At this time, I'll turn it over to Tara for introduction.
Good evening, board members, and Happy New Year. I just want to take a minute to introduce and welcome our newest board member, John Gray. John is filling the vacancy that was left by Max Summey. He's filling the professional engineer seat on the Board of Health. Just a little bit about John. John is a lifelong resident of Randolph County. He's a 1986 graduate of NC State University with a degree in civil engineering with a construction option. He obtained his professional engineering license in January of 1992, and he's currently the regional manager for the Wooten Company. He is the past chair of the Randolph County Economic Development Board, past president of Asheboro Rotary Club, and previously on the Chamber of Commerce Executive Board. John married his wife, Kathy, in 1986, and they have 2 children. John and his wife currently reside here in Asheboro. He's a member of the First Presbyterian Church, where he sings with the praise team and participates in the other activities of the church. Welcome, John, and we look forward to your expertise and what you can bring to the Board of Health.
Thank you. I'm honored to be a part of this team. My computer seems to be a little slow, so I hope you can see and hear me.
We can, John. Thank you for being a part of the board, and we look forward to working with you in the future. Thank you.
At this time, we're going to open the floor and accept nominations for our board chair position. So at this time, do I hear any nominations for our board of health chair?
I nominate Marty Trotter for chair. Robert Brown.
Do I have any other nominations or any discussion? There's been a motion for Marty Trotter to be Board of Health Chair. Do I have a second?
Alan Ferguson, I'll second that motion.
So all in favor, I'd like for you to state your name and affirmation if that's what you agreed to. So Courtney, I'll start with you.
I just had a question. I see it's already a motion on the floor. That went really quick. Is this Marty serving another term? Is this what we're saying?
This is for Board of Health Chair. We reorganize the board chair and vice chair annually. And that's what we're doing, Courtney, is we're taking nominations and voting on the board chair. Marty was nominated by Dr. Brown. The floor was open for additional nominations or discussion. Not hearing any, we move forward with a second. And now we're voting. Does anybody have discussion? All right, then we will proceed with Dr. Brown's motion and Alan's second, and we'll go through the list of board members. And if you will, when your name is called, if you will state your name and your affirmation, if you're in agreement for Marty to be board chair for this coming year. Courtney, we'll start with you.
Courtney Austin Wilson, and yes, I'm in agreement.
Robert Brown.
Robert Brown, yes.
Don't see Mary Ann Evans on.
I'm here. I'm here.
I'm sorry, Mary Ann. Mary Ann.
Mary Ann Evans, agree.
Alan Ferguson.
Alan Ferguson, I agree.
John Gray. Where'd he go? We lost him. Let's see if he pops back up. Julie Mabe.
Julie Mabe, I agree.
Ryan Snipes.
Ryan Snipes, I agree.
Do you get over?
You hear me? I said Ryan Snipes, I agree.
Thank you, Ryan.
Oh, yeah, you're welcome.
Hope Haywood has joined us, so we will document her attendance. Hope, just to bring you up to speed, nominations were made and a second was made for Marty Trotter to be board chair again.
I agree.
John, are you back with us?
Yes, I'm here. Sorry, my computer just locked up on me. I'm on my phone now.
You're good. I didn't realize that you had that we had lost you, but we just took nominations for board chair. Dr. Robert Brown made the motion for Marty Trotter to be board chair. Alan Ferguson seconded that. There wasn't any discussion, so we've taken votes from each board member. So if you would state your name and whether you affirm that nomination.
Yes, John Gray, I affirm.
Carrie's not there.
Can you hear me?
Yes, we got you. Thank you.
Okay, board members, thank you for that. Thank you for that support. I will continue to be the board chair for this year. And Courtney, just a reminder, we vote on this every January meeting, so it's an annual thing, and so it'll come back up next January. Next on the agenda, we need to elect a vice chair for that position. At this time, I'll open up nominations for vice chair.
I, Robert Brown, nominate Alan Ferguson.
Courtney Austin Wilson, nominate myself. Courtney Austin Wilson.
Okay, we have two. Anybody else?
I, Julie May, nominate Dr. Brown.
Okay, anybody else? Okay, so for the three, let me go back and make sure that they're willing to serve. So Dr. Brown, would you be willing to serve if the group voted you to be vice chair?
Yes, sir.
Okay. Alan, would you agree to be vice chair if the group supported you?
I would.
Okay, and Courtney, I'm assuming you would too, right? That you voted?
Assumption, yes.
Yes, okay. All right. I'm not sure how to go through this.
No. I don't know what Robert rules.
I don't have a book. Guys, we're just making sure we're following the right procedure with the Robert's Rules of Order since we've got multiple names there. So if you bear with us just 1 second, we'll get through this, okay?
I'm personally impressed anybody wants to step into the fray.
No, I'm looking up, see what I found on.
I'm gonna move forward and come back to that item. Can we do that?
Yeah.
Board members, to move the meeting forward, would you be in agreement that we move forward with the agenda and I come back to item number 4, the election of the vice chair, just for the sake of time? And while some of the others are presenting, I'll go through the Robert's Rules of Order and make sure that we're following the protocol there. But would everybody be okay with that if I move forward with the agenda?
Yes.
Okay.
Yes.
I'm seeing nods, so.
Yes. Yes.
Okay, all right, so let's do that. Next item on the agenda was the public comment period, and there were no public comments that were submitted by email today, so we have no public comments. The next is the determination of the 2022 Board of Health meeting schedule, and so you should have a copy of that in your packet. The only thing that I'll point out is we normally meet the second Monday of the month. And so I will point out that in July, we will be conflicting with the Board of County Commissioners meeting. So we'll need to reschedule our meeting for July. A couple options out there. The first choice would be, or the first option would be July the 18th, that following Monday. Would that work for everybody's schedule as far as you know? Okay, I'm seeing nods again. So anybody,
Yes.
the 18th would not work for?
Alan Ferguson, yes.
The 18th would not work for you, Alan, or would work for you?
Yes, it would.
Okay, okay.
It would.
Hope that works on your calendar.
I'm checking right now if I get in the right month that we
Yeah,
have.
it's good. We all see on.
Looks like it'll work for me, John Gray.
Yes.
Okay. All right, so with that, let's make the change on Monday, July the 11th. Let's change that date to Monday, July the 18th. And then we will vote with that change in place for our meeting schedule for 2022. So do I hear a motion that we approve the meeting schedule for 2022 with the exception of July the 11th? Will now be moved to July the 18th.
I move to approve the new meeting schedule.
Okay, we've got a
Robert
motion-
Brown.
got a motion from Robert. Do we hear a second?
A second, Courtney Austin Wilson.
Okay. We'll go back to the same way we have on the other items, guys. So Courtney, if you'll just state your full name and yay or no on this item.
Courtney Austin Wilson, yay.
Okay, Robert.
Robert Brown, yay.
Mary Ann.
Mary Ann Evans, yay.
Okay, Alan.
Alan Ferguson, yay.
John.
John Gray, yay.
See Carrie Hampton yet. Hope.
Hope Haywood, yes.
Julie.
Julie May, yay.
Ryan.
Ryan Snipes, yay.
And Marty Trotter, yes. So we have that approved. Okay, next on the agenda, we've got Wayne Jones, Environmental Health Supervisor, will give us an update on on-site wastewater and wells.
What about approval of minutes?
I'm sorry, I skipped that, didn't I? All right, so in your packets, board members, you should have a copy of the November the 8th minutes from our meeting. Do I hear a motion to approve those?
I move to approve the minutes of November the 8th meeting. Robert
Okay,
Brown.
Motion from Robert Brown. Do I hear a second?
Alan Ferguson, I second the approval of the minutes.
Okay. Second round. Any discussion or from the group? All right, we'll go back through the same process, guys. Courtney, you'll state your full name and yes or no.
Courtney Austin Wilson, yes.
Robert Brown, yes.
Mary Ann,
Mary Ann Evans, yes.
Alan,
Alan Ferguson, yes.
John,
John Gray, yes.
Hope,
Hope Haywood, yay.
Julie,
Julie May, yes.
Ryan,
Ryan Snipes, yes.
okay, and Marty Trotter, yes. Thank you. Now we'll move on to Wayne. Sorry about that, Wayne. Wayne will give us an update from his area. Wayne?
Good evening, board. Nice to see you. Can you hear me okay?
Yes.
Okay. I've been asked to kind of give you an update of what's going on in environmental health. Focus mainly on the mega site. Bet y'all haven't heard that word lately. The county has been involved, or our office has been involved with required water sampling around the mega site. We did this in 2018, and I reported to the board those results. At the point we are now with the mega site, trying to obtain permits to begin grading and construction and those sort of things, the state is now requiring additional water sampling. This level of water sampling is quite a bit more extensive than what we did in 2018. Also covers a wider perimeter around the property. So the proposal was developed and submitted for review. And apparently we had at least a preliminary approval of that based on the proposal was copied from another plan that was submitted for permitting. Recently, I guess week after Christmas, we got an update that boundary perimeter would need to be expanded. So now there are additional properties that will be sampled or offered the chance to have their well water sampled. On December 1st, we mailed 48 property owners letters offering them a chance to have their well water sampled. A very broad spectrum of samples, some of which our state lab doesn't offer. So the sampling is going to be done through a private party. We felt like in the controversy of the mega site for some of the people in the area, that having a third party collect the samples and analyze the samples and submit the data to us, there would be no bias or nothing that could be tied to Randolph County trying to push this through. So the contract with Golder and Associates was developed. So we are sending letters to the property owners. They are applying through the county. We will provide that information to Golder. They will actually collect the samples, send it to a private lab for analysis. The results will be sent to us, and then we will work with the state in developing health risk evaluations for each sample that is done and providing that to the property owners. As of today, of the 48 letters we mailed on December 1st, only 14 people have accepted the offer to have their wells analyzed. Part of the proposal was at the end of 30 days, we send the letter again and offer it to them a second time, and the second time being the final time it's offered. So as of January 5th, of the 48 that were sent, we mailed out 30 additional letters to those same people offering a second round of analysis. The difference in the numbers is several people called and said, not interested, don't need our well sampled, we're fine with it. Other properties called and said, there's not even a well on that property. So we didn't have that information. We just identified parcels and provided them the opportunity to have their wells analyzed. Based on the expanded boundary around the mega site, an additional 62 properties were identified. Those letters were also mailed on January 5th. And likewise, they'll be given 30 days and a second round of notifications will be sent to them. Are there any questions on the procedures or what is being done in regards to the mega site water sampling?
Yes, Wayne, this is Alan Ferguson. I have a question.
Yes, sir.
If you can hear me okay?
Yes, sir.
Okay, well, I appreciate what you're doing, first of all, and I am somebody who lives right across the road from the project. My property does not touch on the boundary of the project, but I'm sort of the next one over on Troy Smith Road. As far as I know, I did not get a letter in the first 48 that was sent out, and I don't know if I was supposed to or not, but I mean, I know that I don't always get the mail that's supposed to be coming to me. So that's why I'm asking.
I believe I recognize your name, and I think you are in the expanded list in the 500-foot radius. And okay. So you will probably get that letter. If not, if it didn't come today, I would imagine you will get it this week.
Okay, okay. Thank you for that. When the results are when they go to the lab and they come back from the lab, are the property owners going to be sent a summary of what those results are?
Yes, sir. Those results will come to us first. Then we will provide what we call a health risk evaluation. If everything comes back within parameters, it'll basically be something simple as water was analyzed and found to be safe for consumption. If there's something there, then we will work with the state toxicology office to determine what risks are there and advise you on those risks, and then it'll be up to you on the decision that you would make. Based on the 2018 analysis we did, we sent out, I want to say we sent out 60 some or 80 some letters in 2018, and of those about 30 responded, and we collected samples, and there were only one property identified that had any kind of chemical contaminants, and that was the automotive garage, old 421, where the old Gilmore plant and bulb used to be.
Right, I think I remember when that came up. On the summary that is sent out, I've seen a lot of these over the years, and is this going to have a item by item breakdown of the chemicals that were found? Like so many parts of manganese or iron or whatever? Is that going to be part of the summary?
Yes, I am assuming so. That's the way, if the state lab was doing it, that's the results we get back. Have either that it was non-detectable or that it was below limits. And then if it's there in a detectable amount, then that amount in micrograms per liter is given to you. This is through a private lab, so I'm assuming that it will be very similar. Typically, the water samples results we see, the labs are pretty consistent on how they report. So it'll probably have what was found in your water, what the EPA standard is, so you have a comparison.
Thank you. I just for the record, I think that's very important to have the breakdown of the different elements that are found in the water,
Yes.
since the whole reason for doing it is to monitor if there are any changes that come
That's
about. So in order for this to mean anything, we really need a breakdown of what those components are.
Yes, and you will get a copy with the health risk evaluation of the actual sample results, and that's what will contain that information. I've never seen a water sample that did not contain that, so I can't imagine that this would.
I haven't either, but I've never dealt with a megasite before either, so I just wanted to be sure. One other question, if somebody says, I wasn't in either one of those groups and I'm close by and I want mine tested too, what's the position going to be?
So the current position, unless I'm told differently, is if you did not fall within that boundary, then you're welcome to apply for a water sample and have that done. We don't have, like I said, the state lab, some of the things that are on there aren't options at the state lab for us at the local health department. And so you could work potentially with Golder or somebody that has more authority than I to have that authorized to be taken. The cost of the sample regime that they're doing here is around $800 per
test.
site. Yes.
That's quite a
I
test.
believe that was the number that was said during that initial meeting.
Is the health department's not paying for those tests, is it?
No.
Thanks.
That is being paid for by the Megasite Foundation and the railroad and all of those parties involved.
If somebody
And the taxpayers paying for that.
I'm sure there's some there. I don't know exactly, but from my understanding, it is coming from the North Carolina Railroad, the Greensboro Randolph Megasite Foundation.
Wayne Allen Ferguson, one more time. If somebody does call me and say, I want to get mine tested, who should they call to run that by you?
You can have them call me.
Okay.
I will be a liaison between Paxton Arthurs, our public works director, is kind of over this whole process and obtaining permits. But anybody who has any questions about it, feel free to have them call me directly.
Okay. Thank you, Wayne, very much.
You're welcome. Any other questions? That's it. That's all right.
Thanks, Juan.
Thank you.
Next on the agenda, we have Lindsay Saunders and Crystal Spivey want to share the communicable disease update. Yeah.
All right. Good evening, Board. I'm gonna go over can y'all hear me okay?
Yes.
Okay. I'm gonna go over the COVID vaccine portion of communicable disease, and then Crystal is our lead CD nurse. So she's gonna go over the specifics of our latest and greatest CD updates. So far as COVID vaccine total, did total, just so y'all can have a ballpark figure, since we started, we've given approximately 39,500 vaccines. Those that have received booster doses or third doses for the immunocompromised. We started that back in August of last year. We have given around 5,182. So far, so good with that. A lot of people are coming out to get their booster vaccines, especially here after the holidays, and the cases have been on the rise. We have had quite a few turnout for the pediatric vaccine clinics that we've had. Since we started the beginning of November, we've had over 500 kids come and get their vaccine. We did move vaccine clinic indoors today, so as of today, we're no longer having the drive-through clinic unless the needs arise, which the way today looked, things went very smoothly. We were happy to see that we did have a good turnout with people coming to get vaccines indoors. They didn't mind coming inside, but I think we gave around 50 doses today. We are doing that daily from 8:30 to 4:30. And we are still doing pediatric vaccine clinics on Tuesdays from 2 to 4:30. We did scale that time frame back just a tad, just to see how that goes. So with that being said, as far as vaccines, Moderna and Pfizer, everyone knows that you can get it 5 months after your second dose now. We are, like I said, the boosters are really what's keeping us busy right now, because a lot of people are coming out to get that. And Randolph County as a whole is still at around a 42% vaccination rate. We would like to see that, increase. First doses have slowed down quite a bit. With vaccine readily available to everyone, we aren't seeing that many first doses here at the health department, but we hope that maybe that will pick up soon. So with that being said, that is all I have as far as COVID vaccine. If you have any questions for me, I'll be glad to answer them.
Okay. So I'm going to give a CD or communicable disease update. We've discussed hepatitis A in the past. It still continues to be a problem in North Carolina, definitely amongst our homeless, our drug use, and our men who have sex with men group. So the state CD branch is still trying to figure out ways to help lessen the numbers interstate. As of Randolph County, we have not had a Hep A case since July. But we still are offering the hepatitis vaccine to anybody that comes in that would like that vaccine. Next is flu. So flu activity remains low. For the report we got this week, flu A is the predominant strain that is being seen. But again, our flu activity is still low here in the county. Syphilis, we touched on that in November. It is on the rise in the county, the state, the country, and that's due to the increase of drug use and the risky behaviors that come along with that. And for tuberculosis, we have 2 new active cases here in the county. They were found in, I guess, like the latter part of December. We've been working with those for a few weeks now, and it was very labor intensive. With one TB case, we have to, find their contacts, if they work anywhere, if they go to church anywhere, if they go to parties. We have to find who they've been around so that we can do TB skin tests on them, make sure that they're negative. If not, then we provide treatment as far as latent TB treatment. So we have to do that. There's a lot of paperwork that's involved. And like right now, communication is hard when you have families working, things like that. Getting people to be at home when you need to make visits, as far as the contacts go, and getting that arranged, that's been very trying for us right now. So it does take a lot of work and a lot of hands in it there. And then COVID outbreaks, we do have several of those in the county and our long-term care facilities. And this is not new to anybody, so everybody's following CDC guidance. They're working diligent to do the best they can with their staff and their residents. And so we're just gonna keep plugging along. Any questions?
Got a question. There's a lot of people now getting a second round of COVID. When this is reported to the state, is that included in the COVID numbers, or because they're already in the data system, when they're getting reinfected, are they even included in an acute infection?
Yeah, they are included. It is.
Dr. Brown, I think, was it August or October? October-ish, the state put out a statement to those reporting, and yes, new cases are now. So if somebody has had COVID prior to October of this year, and they've had COVID since October of this year, they're going to be recorded twice as long as they've got a confirmed COVID test.
Yeah, the COVID numbers are actually through the roof if nobody realizes that. Of the tests that we're running in our clinic, the antigen tests, about 50% are coming back positive right now. Even with the vaccine, we're seeing some people fairly sick. Those without the vaccine are still extremely sick, even with the Omicron variant being supposedly more mild. For the majority, it is still more mild, but there's still a large number who are succumbing to the disease itself. I'm sure you all know we lost Chief Chris Hoover from the Asheboro Fire Department after a lengthy battle with COVID just the other day. We have 911 telecommunications operator Joey Thompson, who's on a ventilator. It's just an example of so many that are still out there coming down with it despite vaccines. The people who have been vaccinated tend to do better. But even with the vaccines, some people are still succumbing to the disease. So everybody just needs to continue to be extremely safe. On a separate note, we did have a little bump in flu. It started the week before Thanksgiving and continued up to Christmas. Most of that was college students. I think almost every student we tested from HPU had the flu in time for their exam time. So I encourage people to go get their flu vaccine too. So don't forget that it is flu season. Yes, the COVID vaccines are important, but we also need everybody vaccinated for flu as much as possible.
Thank you, Dr. Brown.
Question, Tara.
Yes, ma'am.
We normally get our flu shot when we're at our meeting. Is that something that we're still doing? Are you guys still offering that for us, or?
We did. We offered it. I think an email was sent prior to our November meeting asking for anybody that was interested to let us know so that we could have the vaccine at our November meeting.
Okay.
And I don't think we heard back from anybody.
I didn't see the email, sorry.
Do we have any left?
We do still have some left though. If you are interested, I can make arrangements to give it to you.
Just shoot me an email, Courtney, or give me a call. We'll get you hooked up if you're interested.
Thanks.
Yes, ma'am.
This is John Gray. You said that the number of flu cases are low, but I'm just curious, what is that number? Do you have a number, or relative to average, it's like 30%, or do you have any kind of comparison?
So John, we don't get actual numbers of flu cases reported. Flu deaths are reported, but we do monitor. There's an influenza-like illness surveillance system that there's a weekly report during flu season. And like Dr. said, there was a peak before Christmas, but at this current time, we're not seeing numbers exceptionally high, but we don't have like an exact number. Now, like last year, if you want to compare it to last year when we were all staying inside, we were all masking, not going anywhere, flu was non-existent, but we are starting to see those numbers creep back up. Do you guys have anything to add to that? Does that answer your question?
Yes, thank you.
And I also would like to personally thank Tara for sending me the updates from the CDC, continued updates on how to manage patients who are positive, isolation, quarantine, etc. It's become a hugely convoluted set of papers to try to sort through and figure out. Well, and what people don't understand, they hear that the CDC says it's 5 days. It is 5 days with no symptoms and no fever before you return to work. It's not simply 5 days. You got to be symptom-free and fever-free. Now, once you have reached that point of returning to work, then you get to wear a mask in public or at work for the next 5 days. And the latest thing out from the CDC is if you've been fully vaccinated and you have exposure, you no longer have to quarantine as long as you are masked in public.
I don't understand any of that. That is like, I'm beside myself on that one. You can have COVID, you can, that doesn't even sound right, but that's what they've come out with, so.
Dr. Brown, did you say the exposure where you don't have to quote unquote quarantine?
Yeah, the CDC said most recently that if you have been fully vaccinated and you have no symptoms and you have been exposed, you're no longer sent into quarantine for 5 to 10 days. You are free to be in public, but you have to be fully masked at all times.
Now that particular piece, and I know it's not spelled out in CDC's guidance. It says, I think if you can't quarantine, then you have to do the 10 days mask if you're asymptomatic. The guidance that DHHS has given us says to use that sparingly. I know probably the general public doesn't know that because DHHS hasn't put out an official anything that specifically says that, but they have told us that verbally. We need to use that sparingly, and that would be useful in situations where you're looking at a business or a school setting that's looking at closing because you've got so many people that are exposed and need to quarantine. For example, if you've got a slew of teachers that are exposed and they're asymptomatic and they're up to date on all the vaccines that they can possibly get, if they're looking at closing school because all of those teachers are going to go home, that would be an appropriate situation to say, hey, to keep school from closing, let's let these teachers stay, but they have to do the 10 days masked to do that. That's the whole point for that. It's not meant for the general population to take that and run and say, I don't have to quarantine. Will everybody do that? I don't know, but that's the intent. That's our understanding behind that.
And Courtney, if you're interested, you can have Tara send you the connection to the CDC site, which gives the January 4th update on.
I have it. Thank you, though. Thank you. That's why I was a little beside myself on it.
It is so convoluted to read, even as a physician. I don't know how the general public even understands all these convolutions. I do this daily, so it's become fairly routine. But for the general public, it's a nightmare. Thank you, Tara.
Thank you, Dr. Graham.
One other question. I don't know if this is the appropriate time to ask this question, but I know that it seems to be, it's going to be the norm that people are going to be getting COVID. So the treatments that are out there for it seem to be the next key. And I'm wondering, what is how are we as Randolph County receiving, I've heard about couple of pills that are out there and then various other ways of treating people once they are sick. Can you say anything about that process? And if you're going to talk about that later, that's fine. I just was curious.
And Dr. Brown, you may know better than we do because we don't actually, provide the medications. But right now, John, it's my understanding, what's available in Randolph County, I mean, it's sparingly because it's just not, the supply is not there, but the monoclonal antibodies are available in certain places in Randolph County when they can get it. But we're also hearing that the monoclonal antibodies may not be as effective for the Omicron variant. You've heard recently in the news that molnupiravir and Paxlovid have been approved as antivirals for treatment. But it's also my understanding that those are limited in supply as well. So I don't know how readily available those are in Randolph County. Do you know more, Dr. Brown?
Yeah, I want to ask that for Mary Ann. My experience is most of the pharmacies in the area are not getting supplies of these new drugs yet. The federal government will be funding the new drugs so that it's not going to be out of pocket. But right now, there's a huge demand and there's not supply. Right now, your best bet is still monoclonal antibodies if you are a high-risk patient to be given as soon as possible after the diagnosis. The monoclonal antibodies seem to make a difference the sooner they're given to an individual. They do not know how effective they are yet about the Omicron variants, but it's the best we could do right now. Mary Ann, I don't know if you've gotten access to any of these new medications.
It's my understanding that each pharmacy has to apply to be given a shipment of the new oral treatments. And how they decide who gets them of the applicants, I don't know. The other thing I don't understand is I read somewhere that there will be a website where providers can go to find out who in their area has been allotted a shipment. I'm going to be really curious to see how accurate that is and how well that is kept up to date, because, if our pharmacy gets an allotment this Thursday and the pharmacy down the street gets an allotment on Tuesday and we sell out, I mean, I don't know how the provider is going to know where to send their prescriptions. It just seems like it's going to be a very, very complicated process for a very long time.
I totally agree.
Mary Ann, have you seen home test? Because COVID home tests where people are trying to get those, they're not been able to be found.
Yeah, I think our experience has been that the supply is depleted all the way back to the wholesaler level. I think everybody's pretty much just waiting for the request for the federal government to send it at home plan to kick in. We continue, as I'm sure all the pharmacies do, continue to try to order from the wholesalers and keep your fingers crossed that you get it, but there's just no supply.
It would be nice if the government, it would be nice if the government just used the census and sent out home tests to addresses.
The federal government right now has allocated 500 million rapid tests to be sent to homes. They're still working on that, but right now it's an allocation of 500 million tests, which are going to go quickly.
Yeah, because they don't even have the platform set up for the households to order them yet. There is a partnership with LabCorp on the health department's website to be shipped at home. Tara, can you tell us more about that? Is that working well?
Mary Ann, I haven't heard of anybody using it. So I honestly can't speak to that.
I have found that the at-home tests, when they're positive, seem to be fairly accurate, just like the rapid antigen tests are in the doctor's offices. However, if the at-home test is negative, and it's the same in our offices when you have a rapid antigen test being run, when it's negative, accuracy is not so great. So we've got a lot of people coming in who tested negative at home, and yet when we test by sending out the PCR test or do a rapid antigen test in-house or a rapid PCR test in-house, they're actually coming up positive even though they were told they were negative with an at-home test. So you got to take these with a grain of salt.
I have one more question, not to get off the subject, but is the, Tara or Lindsay, are the testing sites, like at Randolph Community College and First Presbyterian Church, are they also vaccinating or are they just strictly testing sites?
First United Methodist is doing both.
Okay.
I believe RCC, Ashboro, I think it's testing only, but I know they're doing both testing and vaccine at RCC in Archdale.
You said both, Tara, in Archdale?
Yes, ma'am.
Okay.
Okay, thank you.
Yes, ma'am.
Okay, anybody else? All right, well, Lindsay and Crystal, we'll thank you for the time tonight, for being here. Next on the agenda, we've got Jennifer Liaisons. She's going to go over our Board of Health operating procedures.
Good evening, board. Can you hear me okay? Great. We're going to keep this short and sweet. Brooke was very kind to include the Board of Health operating procedures in your packet that you received in your email. And I believe the board reviews these operating procedures annually. The last time they were reviewed and approved was January of 2021. And we invite any discussion of any recommended changes to the Board of Health operating procedures now, if you would like to discuss that.
Okay, board members, you have that in your packet. Is there any discussion for Jennifer? Okay, hearing none, this is an action item, so I'll need a motion to approve the Board of Health operating procedures as presented.
Robert Brown move to approve the Board of Health operating procedures as currently amended.
Okay, we have a motion from Robert Brown. Do I hear a second?
Alan Ferguson, I second the approval of the operating procedures.
Okay, we have a motion and a second. Is there any discussion? All right, guys, we'll go back through the list like we have before, and if you'll just state aye or no in favor of approving the operating procedures. So Courtney?
Courtney Alston Wilson, aye.
Okay, Robert?
Robert Brown, yes.
Mary Ann?
Mary Ann Evans, yes.
Alan?
Alan Ferguson, yes.
John?
John Gray, yes.
Here, Hope?
Yes.
Julie?
Julie Mabe, aye.
Brian?
Ryan Snipes, yes.
Marty Trotter, aye. So motion carries. Thank you. And turn it over to Tara for the health director's report, and then we'll come back to item number 4 at the very end. Okay, Tara?
Thank you. I want to thank members of my team who took the time to spend a little extra time at work this evening to come provide you all with an update. I know for the last 2 years, you've heard mostly about COVID-19 and our response efforts. And while that continues, you know, we're pretty much back to full speed at providing all of our services. Doesn't mean it's easy, but we're back doing that. And I wanted you to hear what we're doing outside of COVID. So thank you to Wayne and Lindsay and Crystal. I do want to say too, you know, our communicable disease and nurse teams have worked really hard through this pandemic. Early on, there were many, many hours, and there's still many, many hours. But when things crop up like TB is really time involved. It's intensive. I mean, I'm waking these girls up at 5 o'clock on Christmas Eve morning, saying I've gotten a call from the hospital that we've got a potential TB case. And they're here in the office working Christmas Eve to get a head start, a jump start on TB. So there's just a lot involved, not going to get into the weeds. It's what we do for public health. So I want to thank Lindsay and Crystal and April and all those that have been involved, because they've really worked hard to deal with COVID and all of the other communicable diseases that we see regularly. I know Crystal and Lindsay both touched on pieces of COVID, but I'll elaborate a little bit more. I know you all have been watching the news, and we're reporting all-time high record numbers of cases. I know nationally there's records, but North Carolina alone in the last couple of weeks has broken records. Last Friday, the state of North Carolina reported, I believe, 28,000 plus new cases in one day. That's the highest number of cases. When you look back where we were in January of 2021, when we were seeing really high cases, the state was reporting about 11,500. That was the highest number last January. So if that shows you what the Omicron variant is doing, it's huge, and it's taxing. Today, the state reported over 18,000 new cases since Friday. We're at a statewide level of 31.1% positivity, and statewide there's 3,850 people in the hospital. Here locally, since March of 2020, we've had a total of 26,350 positive cases. Just since we sent out the report on Friday, that's about 500 new cases since Friday. So you can see where we are. That's just a couple of days and we've got 500 cases. Keep in mind, it's not a true number, because people don't report home test positives. So, and there's a lot of people that if they can get their hands on a home test, especially before Christmas, there were a lot of home tests that were positive that were never reported. We're at our highest percent positivity since the beginning. Today we're at 23.7% in Randolph County. And that's as a reminder, that's out of all the tests that were completed, the percent that came back positive. We're up 2 deaths since we reported on Friday. We're at 353 deaths in Randolph County. Crystal talked about outbreaks. Lindsay talked about the vaccination for the total population. And Lindsay shared how many vaccines we've done here. And she also talked about us shifting from vaccine clinic being drive-through. That has been super successful. Our team ran a well-oiled machine. I will mention too that we have been using surge staff. We've been using CCTC for surge staff and support since summer of 2020. We still use them because we don't have the capacity to do it all. CCTC continues to help us. They're shifting with us from outside vaccine clinic to indoor vaccine clinic. Things went well today. We think they will continue to do so. We had a little bit of concern about monitoring because that does take a little bit of space. We've spaced people out in our WIC waiting room and our main waiting room, and that went well today. I think if we stagger folks at the right times, that will continue to go well. We will leave the tents in place for just a little bit to make sure we don't have to, if something crazy doesn't have to happen and we have to shift back to drive-through clinics. You all know the demand for testing has increased. We've talked to StarMed. We touch base with them periodically, make sure they're good, make sure they think they can meet the demand. They just got a shipment last week of tests and they feel completely comfortable continuing doing what they're doing. They feel like they're capable of accomplishing what they need to accomplish right now with the testing hours being what they are. So just so you know, we do touch base with them regularly to make sure they're good. We're trying to increase awareness of testing locations. Our team is, of course, social media, our website, but they're also looking at other alternative means of getting the word out about testing so folks know where they can go quickly to get a test. As Dr. Brown mentioned, the isolation and quarantine guidance was updated on December the 27th. I'm not gonna fuss, I don't guess, but like Dr. Brown said, that guidance is pretty tricky to navigate. And when it first came out, all we had was pretty much a little chart saying this is what you do if you're exposed or if you're positive. So it took us a minute, and thankfully CDC finally put out some detailed, specific guidance, but it still takes us. When people call me today, I still have to say, give me your situation, and I have to look at the guidance and walk them through and say, this is how we handle this particular situation. So we've actually had some deja vu moments because it has made us feel like it was way back in the beginning when guidance was changing regularly. Hopefully it's not going to continue this way, but I think we're getting a pretty good handle on this updated guidance. We want folks to understand that this updated guidance is intended for the general population. It doesn't apply to every situation. It's not meant for congregate living settings like detention centers, long-term care facilities, homeless shelters, and I think cruises is in there. Does that sound right? So it's not meant for those settings. There's specific guidance for those settings. I do not believe the guidance for those settings has been updated yet to address what the quarantine and isolation is going to be. Or I do believe there's a note somewhere, I've seen it, that isolation and quarantine will continue to be 10 days in congregate for residents.
Can be the 5 days, providing either they meet the criteria or in crisis situations.
So congregate living, we believe the isolation quarantine to be 10 days for residents, and depending on what kind of situation a long-term care facility is in, staffing wise, there's some wiggle room. It can either be a 10-day, or if they're in a crisis situation and they've got to have staff on hand, we can do the 5 isolation or quarantine, and then 5 days back masked. Child care center guidance we are waiting for. We have left child care center isolation and quarantine for the small children at a 10-day isolation and quarantine. So we're awaiting guidance for those environments. And we will share that as soon as it becomes available. Because I've had several calls today myself with questions about the child care center environments. I'm kind of getting out of order here a little bit, but I should have mentioned this earlier. The impacts of COVID, the numbers, Dr. Brown's already touched on how Omicron is, while it's being posed as possibly causing less severe illness, the hospitals are still seeing high volume. I know my last exchange with Dr. West at Randolph Health, while they weren't full of COVID, they're full in every way, and folks are in the ED waiting for a bed. It may not be for a COVID bed, but with other respiratory illnesses and just other illnesses out there right now, the hospitals are feeling the pinch of this Omicron variant. And I will also say, just for EMS, I talked to Donovan last week. They're seeing the impacts of COVID. I think Donovan told me he had 18 staff out that had been exposed or had the virus. So on top of any vacancies they have, that could potentially take trucks off the road. So it's hitting and it's hitting hard. We encourage folks, if they haven't been vaccinated, to get the primary series. If they're eligible for a booster, to get boosted. And I know people say, you know, I hear people that have been first, second dose boosted still getting it. Yes, but most times it does cause less severe illness. It helps keep you out of the hospital, and it helps keep you from dying. So that's still our message. We're ready to move on, just like everybody else is. So our message is to get vaccinated. Shifting gears, I do want to make y'all aware that we have, it's COVID related. We received some funding from the state to hire, whether part-time or full-time, but we could hire some positions that will help. They're called public health school liaisons. We were able to hire 3 temporary part-time positions, and these folks just started. And these folks will, if schools call and need some specific guidance or assistance with identifying exposures, other communicable disease related questions or something, they will essentially be a point of contact for schools. And this funding lasts through, I believe, May, unless something changes. So they're just getting up and going. Hopefully we'll have them trained and get them available to the schools in the next week or so. Switching gears to our dental program, I wanted to make you all aware. I think most of you have met Dr. Mustafa. She's our dental director and dentist. She's always thinking about what can we do different? What can we do to make things better? And for as long as I can remember, and she's only been here since October-ish of 2019, she wants to be able to serve as many people as possible with quality services. So she's been talking about, can we get somebody to come in and do practice management? Can we get somebody to come in and assess our program and see what we can do to make sure that we're providing all the services we can provide in the most efficient manner? So I said, find a consulting company, get us a quote. She did that. We got a really high priced quote. So in the quote this company provided, it said they had worked with local health departments. I said, ask this company how these health departments pay for this. Anyway, so I don't know how she did it, but she came back to me and said that the North Carolina Oral Health Collaborative had agreed to cover the cost of this practice management. I'm just going to say the quote was for $25,000. That's not in our budget. So the North Carolina Oral Health Collaborative, it's also underwritten by Blue Cross Blue Shield, is going to pay for us to have a program assessment for our dental health program. So hopefully in February, March-ish, the consulting company will be coming in for a day and a half to evaluate our program, every aspect of it, and then give us kind of a roadmap of suggestions of what they recommend we do so that our dental clinic can be the best that it can be. So I have to give her a shout out for doing that. I'm winding down. The last couple of things are just kind of nominal things. I didn't mention this when I introduced John, and I may not have told him because he might not have accepted this role when I asked him, but John, you're going to be hearing from us. Board of Health members have to have new Board of Health member training within the first year of becoming a member. So you'll be hearing from us. Depending on how things go, we like to do things in person, but if COVID doesn't clear up, it may be virtual or something online. Just know that that's coming. And then the last thing that I have is, this is something else that's kind of, COVID has caused some hiccups, but I just want to make sure that everybody is aware that every board member has been issued a Randolph County email address. We would like for everybody to use the Randolph County Board of Health email address for board communications. If you can't remember what your email address is, or you can't remember how to access it, or you can't remember what your login information is, if you would reach out to Randolph County IT via phone, you can call them at 336-318-6411. Or if your schedule allows, you could drop by IT at the Randolph County office building. When you enter the main entrance of the Randolph County office building, you just go right to the left and hit the button, and they will buzz you in, and they will be happy to assist you getting your email set up. So just whenever, if you call or if you show up, just make sure you have the device that you would like to receive, use your email address, use your email for with you. That's pretty much all that I have. Does anybody have questions?
I had a quick question, and you may have covered this previously, I'm sorry, but you mentioned that there's been 2 deaths, and I was just curious, when somebody is from Randolph County, but they die in Chapel Hill or Winston-Salem, is it reported as a Winston-Salem death or a Randolph County death?
Correct. Do you want to speak to that?
So we do.
Can you hear Crystal? Crystal's answering that.
Can't hear.
Can you come back up?
So if they, regardless where they die at, the information is sent from the hospital, hospice house, whatever, and that is counted towards Randolph County.
It's my understanding, it's based on the address at which they live, where they reside.
Yes.
Okay, thank you. I was curious about.
Any other questions?
Okay, thank you, Tara. Here, can you get this pulled back up? So board, I want Tara to, she's going to get the log back in on the computer so that I can read to you the Robert's Rules of Orders for multiple people being nominated for a position, and we'll go through that, and then we'll go through what I've read. Staff, y'all want to cut out. I'll do what to cut out. I'm on those steps there, but y'all go ahead. Thank you. Okay, board members, so according to Robert's Rules of Order, under the section of elections, and then election by voice vote, since that's where we are tonight, when more than one person has been nominated for election, and the election is by voice vote, the chair takes the vote of the candidates in the order in which they were nominated. So in the order that were nominated, I've got Alan, then Courtney, then Robert. Members must remember to vote yes for the candidate they want to vote for and no for the other candidates. The first candidate to receive a majority wins. So what I'll do is I'll start with Alan, and we'll need to go through each person, and each person will need to either say yes or no in favor of Alan. So yes, your vote is for Alan, or no, if your vote is for someone else. And then I'll proceed on to Courtney, and then I'll proceed on to Robert. And then when it's all said and done, I've made a spreadsheet here real quick. We'll tally the votes, and the majority, as the Robert's Rules of Order state, will be the winner. So first up is Alan Ferguson.
Wait a minute, let me ask.
Yes.
Do you think any statement needs to be made about like who each person is? You know, like you've got John Gray and he's new, so he doesn't know.
Okay.
So I mean, I think, you know, those of us that have been on the health department for a while know all of them.
Okay,
probably would feel comfortable with any of them, but there may be some tipping factor there. And so I just thought you might want to make some statement about each person, or have each person to make a statement about themselves.
Okay. Is there a preference how I do that?
At your pleasure, Mr. Chairman.
Okay. I'll make a statement on each of the individuals that have been nominated, and if there's something that you guys want to add about yourself, certainly do that. First is Alan Ferguson. Alan's our second newest member of the Board of Health. His background is an attorney, and he's been on our board for a year now. He's gone through the process of hiring the new director. And so Alan Ferguson is our first one. Anything you want to add, Alan?
The only thing I would add is I'm from the Liberty area, just so John knows where I'm from.
Perfect. And then Courtney Austin Wilson has been on the board several years. I can't remember now exactly how many.
Just entering her second time. She's going into her 4th year.
So Courtney's going into her 4th year. Let me back up on Alan. Alan is a community representative. Courtney is also a community representative. And Courtney, you live in the Trinity area, Archdale Trinity area?
Yes, yes.
And is there anything you would like to add? She's a business owner, by the way, too.
Yes, farmer, business owner, owned medical practices in the past, specializing in mental health and general practitioner. Just a dedicated advocate for the community that I serve. I have my family lived in Randolph County since the 1800s.
All right, thank you, Courtney. And last is Robert Brown. Robert is our medical doctor who is on the board. I mentioned that at our last meeting, the different types of roles that individuals serve in. Robert is our medical doctor. Robert, I've lost track of where you're at. You're in the Archdale area as far as your office, but you want to share?
Office in Archdale, and I live in southwest part of Randolph County.
Okay. All right. So anything else you wanted to add, Robert?
Yeah, I think it's my 5th year maybe on the board now.
Okay.
I've been doing this for 5 years. I was the vice chair last year.
Okay. All right. So any other questions or comments before we go through each one of these and vote? So remember, members must remember to vote for the candidate they want to vote for and vote no for all other candidates. So this time I'll start with Alan, and I'll call the first name, and if you'll state your first name, last name, and you'll say yes or no for Alan. Courtney?
Courtney Austin Wilson, no.
Robert?
Robert Brown, yes.
Marianne?
Marianne Evans, no.
Alan?
Alan Ferguson, no.
John?
John Gray, no.
Carrie's not here. Hope?
Hope Haywood, no.
Julie?
Julie May, no.
Ryan?
Ryan Snipes, yes. Alan wouldn't even vote for himself.
All right. And Marty Trotter, no. All right, next on the agenda, we've got, our next nominated was Courtney Austin Wilson. Courtney?
Courtney Austin Wilson, yes.
Robert?
Robert Brown, no.
Marianne?
Marianne Evans, yes.
Alan?
Alan Ferguson, no.
John?
John Gray, no.
Hope?
Oh, man, y'all are killing me. Hope Haywood, no.
All right, Julie?
Julie May, no.
All right, Ryan?
I've already voted, Marty.
But you have to vote no for this one.
No.
Okay. And Marty Trotter, no. All right, for the nomination of Robert Brown, Courtney?
Courtney Austin Wilson, no.
Robert Brown?
Robert Brown, no.
Marianne?
Marianne Evans, no.
Alan?
Alan Ferguson, yes.
John?
Gray, yes.
All right, Hope?
Hope Haywood, yes.
All right, Julie?
Julie May, yes.
All right, Ryan?
Can I change my vote? I'm just messing with you, Marty. No.
Okay, Marty Trotter, yes. So 1, 2, 3, 4, 5. So we've got 5 yeses for Robert. And then we had 2 for Courtney and 2 for Alan. So Robert Brown by majority, you'll be the vice chair for the next term, okay?
Thank you.
All right. Thank you for that. So moving forward, obviously we'll have this experience under our belt, so we'll not have to refer back to the computer and the book. So we'll know how to manage that moving forward. So that, Tara, was the final item on our agenda. Then we went back to item number 4 for the election of the vice chair. So at this point, we're at the end of our agenda. Do I hear a motion to adjourn?
I move to adjourn.
Robert, second.
Ryan Snipes, I second.
Okay, so motion second. So Courtney, you vote aye or no?
Aye.
All right, Robert.
Robert Brown, yes.
Okay, Mary Ann,
Mary Ann Evans, yes.
Alan,
Alan Ferguson, yes.
John,
John Gray, yes.
Hope,
Who said yes?
Julie,
Julie May, yes.
Ryan,
Ryan Snipes, yes.
Marty Trotter, yes. So our meeting is adjourned. At the bottom of your agenda, folks, just please notice that our next scheduled meeting will be on Monday, March the 14th, 2022. And as far as location, we'll let you know closer to that day. So thank you for being here tonight.
And please, everybody, just be safe out there with the COVID.
Thank you.
Thanks.
Thank
You.
Thank you.
Here we are.
What do you say?
We off now?
Michael.
Do I end it up?